Thank you, Dale. It's nice to be here. I commented to several of you that when I was a graduate student here at Kansas State, my best friend Roger Swanson and I took care of this ranch that we're on today for Dr. Ed Smith, no relation. And we had many wonderful memories of up and down the hills on horseback, and when they weren't watching, perhaps a motorcycle or two. But also I was thinking back as I went into Manhattan last night about how the city has changed and how the campus has changed, because I used to spread manure where Bill Snyder's family stadium is using a Farmall tractor and a John Deere manure spreader. Now I do it with a microphone. So it's good to be back, and I'm in private practice, and I'll show you here, get the buttons straight on this. I need to disclose a few things. I am in private practice. I do not dispense drugs. I do not participate in any incentive or rebate programs, so I can talk to you without any monetary influences. I have no research income, although we do have a research division within our practice, but I have no financial investment in that. I have spoken at meetings sponsored by BI. It's been about 3 years ago since I've done one of those, and I will not accept an honorarium for this meeting. It's a little give back to the university for what they've done for me. Plus, once I finish, you'll think, I'm glad he didn't charge me for this anyway. So anyway, there's 11 veterinarians in our practice. We work in about 13 states, a lot of feedlots and stocker operations, backgrounding yards, and I'm expanding my part of the practice out into some fairly large ranches as we speak. So I think of this cartoon as I begin a meeting. The veterinarian is saying to his client, he says, "You're worried, what about me? I've never done this operation before." Well, I have done this talk a time or two, and I hope it goes fairly well. So how do you like living in Stillwater? Well, it's not quite as good as Manhattan, but you know, there we have famous people there. The one on your left is my oldest daughter, and on your right is her girlfriend. In the middle, old Garth Brooks is always looking for some attention. And this is where Garth lived when he and Sandy married in 1987. And so over the porch it said, Garth and Sandy Brooks lived here in 1987 and 1988. Well, a few things happened in his life, and later we noticed that the name Sandy had been removed and the house had been repainted the same color. Rumor is that Tricia Yearwood paid for the paint job. But more recently, when you drive past, the darn house is gone. Just a vacant lot. So I don't know if Tricia Yearwood had anything to do with that or not. But in Oklahoma, we have some really great roads, and we live in gated communities, so it's not too bad of a place to live. But I do enjoy coming back to Kansas from time to time. So we're in the stocker business. I'm in the stocker business. We have about 1,000 head in a backgrounding yard right now. And we are the intermediate step between the cow-calf operation and the feedlot. And of course, get to the feedlot, we put on good gain, fatten them up, they grade well nowadays, and we produce America's best, most flavorful beef product, or food product. But you know, as we are raising these calves, buying these calves and trying to develop them, I think of this bank just west of Enid, Oklahoma. It's Mino, Oklahoma, and on the bank sign it says Mino Guarantee Bank. So my thought is, why would you put your money there if they're not going to guarantee it? Well, that reminds me of this veterinarian consoling his client who just bought a horse. He said, "I hope you didn't pay too much for him, Sam. I want you to brace yourself for the bad news to begin with. He's not a 2-year-old. So we see some things like that when we buy calves. A little bit light in here, we can't see the images real well, but we got several sick calves that arrived 2 days before this picture was taken. So have to brace yourselves to the bad news. The outcome is not going to be good when we have that much sickness early in the course of the ownership. And why do those calves look that way? Because primarily it's a pneumonia problem. And as we look at this lung, let's see if I get the right button for the red dot, the pink part is normal. And all this dark part down here is abnormal, it's diseased, it can't receive air, it is incapable of exchanging carbon dioxide for oxygen. So all the king's horses and all the king's men and all of the good antibiotics that we have can't change the damage that's already in that lung. So this calf is going to get retreated not because the drug didn't work, but because there's not enough good lung left for the calf to sustain life and sustain it well. So the point there is we've got to intervene early with a good product and couple our treatment with other good management practices for a successful outcome. We've known for many, many years that if we have to treat calves, even in the stocker phase, we can have an impact on their performance and even their carcass quality for the rest of their life. We look here just before I left Oklahoma State in 2000. we received some 422-pound heifers, and we looked at their gain during the 42-day backgrounding period before they went to wheat, and we compared the gain to those calves never treated, treated once, or treated more than once. We see that those that were never treated gained 2.3 pounds per day. If they were sick one time, they gained 0.15 of a pound less for that 42-day period, and if treated 2 or more times, then they gained a half a pound less than their pen mates or their herd mates that had never been treated. We were able to follow these calves through wheat and also follow some of those through the packing house, and we found that even months and months later, those calves that, that took off on me pretty quick, those calves that, there we go, those calves that were never treated in the backgrounding phase, 66% graded choice. Treated one time in the backgrounding phase, that drops from 66 to 59% grading choice or higher, and treated 2 or more times, only 41% graded. That's very important, especially when you're selling cattle on the grid. So a few pre-arrival considerations for us. Pre-weaning vaccinations, auction versus farm origin, commingling, purchase group size, the time it takes to assemble the calves, pens ready, water, hay, and so forth. Even some simple things like bedding can provide some benefits. This is Kobe Barnes. Kobe cowboys for us periodically. And Rodney the bull got into a bullfight at age 26 and lost, so Rodney is no longer with us. So what about these pre-weaning vaccinations? Dr. Davidson covered this very, very well, and I just want to reiterate some of the important points that he made. Calves can respond to a modified live virus vaccine in the face of maternal antibodies, and generally that opportunity to vaccinate that beef calf will be at branding time, 60 to 90 days, even 100 days sometimes. This has been documented by challenge studies in Arkansas, and he talked about the herd study that was done there. And so we can vaccinate those calves on the ranch at about 60 days of age. 2 studies, one in Arkansas and one in Oklahoma. And that worked just as well as gathering those calves at extra time, 2 to 4 weeks prior to weaning, and then boosting them again at weaning time. So it's going to save labor, it's going to save stress on the calves. But what's really important is that more ranchers and farmers, especially if you're buying those calves, if they'll just give that shot at branding time, then the shot that you give them when you receive them into your stocker operation is actually the booster, and health will be improved as a result of that. Well, about 70%, 75% of cattle operations sell those calves through auction markets. That's not 75% of the calves, but 75% of the beef cattle operations sell through a sale barn. And we learned many, many years ago in a Canadian study where graduate students followed tens of thousands of calves from the auction market to the feedlot and followed the data on out until closeout, that the more farms of origin that are represented on that load going to the feed yard, the greater the risk of fatal fibrinous pneumonia. So commingling is a very big stress on calves, maybe even as stressful as weaning is. Put them together and those calves are really challenged. And we also know from an Iowa study that Dr. O'Connor was the lead author, and Dr. Mike Apley, our friend over at the College of Veterinary Medicine here at Kansas State, participated in. They went through 5,000 head and they looked to see whether these calves came from a single source or whether they were commingled. If they were single source calves, 10% were pooled. If they were multiple source calves or commingled, about 29%. So about a 2.9% greater risk of being pooled for BRD if they came from multiple sources. And of course, that's where a lot of us buy our calves. We buy them in the auction market, 1s and 2s and 3s at a time because they're a little cheaper that way rather than buying large groups. Weaning status, we bring those into confinement like into a backgrounding yard or into the feedlot. Those non-weaned calves are 3.4 times more likely to develop BRD than calves which have been weaned. Again, weaning is a severe stress. Stress leads to more respiratory disease. Now we mentioned the number of calves in groups. This is a K-State study. It's the second of 2. Now these would be the larger calves. I think these calves weighed 650 or so. And what they did is they compared the sale price of these calves over here on the left, the difference in sale price in these calves that are being sold in a group compared to one calf of similar quality. You can see that the price per hundredweight peaked out there at probably just over 1 semi-load of cattle, somewhere between 1 and 2 semi-loads. That was worth close to $6 a hundredweight, so for each semi-load of cattle, that's about $3,000 additional income if we can sell in groups rather than selling as singles. Moving over into Arkansas, a study that was published in 2013 reveals several interesting things. Number one, 75% of the calves that go through that large number of sale barns that they audited are sold as singles. I'll repeat that. 75% of the calves were sold as singles. So that's a lot of commingling. It's probably, as we move to the east, more barns sell that way. Maybe it's to make the sale last longer, makes it think like it's a bigger barn or something, I don't know. But if they had a group as small as 6, they brought back $5.36 a hundredweight more than calves sold as singles. And so when we go out and we try to buy some of our profit by buying these calves 1 and 2 at a time, we are assuming more risk, and so it's just a little more of a challenge that we have to deal with when we're managing through their sickness. Another interesting thing that came up in a recent study was whether or not having an ear tag at the time you bought the calf was a good thing. And so Dr. John Richardson and his graduate students, Dr. Moniz was a senior researcher here, they looked at these calves that did not have an ear tag and those that did have an ear tag when they bought it. They looked at health and performance. They had bulls and steers, but we throw those all together as far as a pull rate. If they didn't have an ear tag, whether it's a fly tag or had a number on it or the name on it, they pull almost 38% of the calves, whereas if they did have a tag, they pull 25%. What's that tell us? If they gathered those calves and took the time to put a tag in its ear, they're probably doing some other things that are favorable for that calf, such as maybe better nutrition, maybe they vaccinated the calf, better parasite control, or whatever. But that's a nice, remarkable difference there in the pull rate between those two groups. Looking at the gain, the calves that had a tag in their ear gained 16 pounds more during the backgrounding period, and that equates to a 0.29 pound per day increase in daily gain. So if you don't tell your neighbor this and you're in the barn, you can bid just a little bit more for those if this holds true across all calves, but I wouldn't tell it to your neighbor that you're competing with. They'll try to buy the same calf. And also some of these pre-arrival things, are we ready for those calves when we buy them so that when they come in we have hay available, water available, the pen is clean, and even some such simple things as bedding can make a difference in the stress level in the heat of the summer because it's cooler to lay on straw than it is on the pen floor if you're receiving those into pens. Or in the wintertime, of course, they're going to be more comfortable on some dry bedding as compared to laying down on some cold, damp ground. So this is a veterinarian, he's on the phone, he says, "Hello, Dr. Henson, this is Dr. Fred Moss, the veterinarian. Listen, I accidentally shot myself with a tranquilizing gun. You know what? I don't really give a darn, so hopefully you're not at that point here today. So hopefully you got a few give a darns left in you." So moving on out now to some post-arrival considerations. These are some things that we're going to talk about briefly as we go through our presentation. Again, this is what we're going to consider after these calves arrive into our operation. Kill versus modified live. Dr. Davison mentioned this. And there was darn near some knockdown dragouts in the old days, especially if you went down into the southeast, into Kentucky, Mississippi, and Alabama, and you brought up the subject of MLV, those producers and veterinarians would jump out of the chair and say, "Son, that kills these calves. We can't use MLVs." Well, the industry has learned that the MLV is superior to the kill vaccines for our stocker and our feeder cattle. And so we don't have those same arguments, but there's data out there which shows us that if we look at the kill vaccine, pull rate in calves that receive kill versus modified live vaccine, those that receive the kill were 2 times greater risk of becoming sick compared to those that receive the modified live vaccine. So it's a myth, though, that vaccine prevents all disease. Vaccine is one of the many tools that we use in our armament to fight respiratory disease and to keep our calves healthy. So it's not only vaccine, but it's going to be nutrition, it's going to be weaning management, it's going to be environmental management, and on, and even metaphylaxis for these higher risk calves. So here's a study that's a busy slide, and it's probably hard to see with the light in this room. I'll try to work us through this. Now this slide shows a study which was done not too long ago where they bought some high-risk calves. They were 5 weights. They bring them into confinement to background these calves, and we have 4 groups. We have the controls, which did not receive metaphylaxis, and they did not receive a vaccine for the first 30 days. And then a group where they only received metaphylaxis with a macrolide antibiotic, I think it was Raxin in this case. Another group received modified live vaccine, but no metaphylaxis. And then the fourth group received both metaphylactic antibiotics and a modified live vaccine. So to see the benefit here, what we really need to look at is including the meta only with the meta plus MLV, comparing that to the controls and the MLV. What we find is the combination of metaphylaxis, and metaphylaxis was very important in the health of these calves, and the modified live is going to result in a lower first pull rate. It's going to reduce our chronics. There was not a lot of death loss in these calves, and numerically it was lower. And we spent a little bit more money on these calves that we treated metaphylactically. So if we then move and look at the performance of these calves, again, we have the same control groups, but we have, if we look at the gain in these calves, when we compare the controls to the metaphylaxis group, the metaphylaxis group gained about, 27 pounds more, and if we compare the controls over to the metaphylaxis plus MLV, about 38 pounds more weight gain during that 56-day backgrounding period. That's very significant. So increasing gain, and also if we look at those who were treated metaphylactically or metaphylactically plus MLV compared to the other two groups, that we will see that the feed conversion was also more favorable in those groups. So if we use the tools of metaphylaxis in high-risk calves and the modified live together, we're providing immediate protection against the bacteria that are present in the respiratory tract and the spreading between the calves in that group. And secondly, we are providing protection for the long term by using the vaccine. So Dr. Davidson mentioned some of these delayed vaccination studies where they can wait 30 days and they see no benefit to waiting versus not waiting. So it's kind of a toss-up. But the question is, what was the viral challenge in that set of calves where they did the study? So in these, for example, if we had seen a viral challenge at a couple of weeks after they entered the backgrounding operation, the outcome could have been much different in those calves which were not vaccinated. So I know we don't want to stop vaccinating. It's still a very useful tool. It's an effective tool. It's just that we need to use that as part of an overall management protocol rather than just depending on vaccine itself. So holding times are extremely important, probably just as important as vaccination schedules. And we learned a long time ago through the Ranch to Rail program and others that at about 45 days post-weaning, we see some magic happen. It takes about that long for them to recover from the stress of weaning. And I know that when we first started doing our backgrounding work at Oklahoma State University, when I was there, we used to send them home at 30 days after we received them. And looking back and looking through our records, that was much too soon. Is 60 days the ideal number? So far, we don't see much of an advantage in holding calves for 60 compared to 45, but that question does come up. Now, looking at different sources or different backgrounds of calves does show some differences here in a study that was done by Dr. Stepp, who's here in the room with us today. In this study that he published, they went out and they bought some calves and sent them into Stillwater to their backgrounding research facility. And those came from the sale barn in this column right here. These other three groups all came from the same ranch, these ranch origin calves. But in this column right here, where it says wean, they pulled these calves right off the cow and sent the calves to Stillwater, Oklahoma. In the groups that says wean 45 and wean vac 45, they held those calves for 45 days on the ranch and then shipped them to Stillwater, Oklahoma, with one of those groups being vaccinated and one of those not being vaccinated. So what we see here is that there's a great advantage to that weaning period, and also there's an advantage numerically in buying calves from the ranch versus from the sale barn, although that morbidity or that pull rate difference between those that were bought at the sale barn and those who were taken directly off the cow from one ranch was not statistically different. Numerically, there is a difference there. The only death loss of any significance was in those that came from the auction market. And then, of course, the health costs would be lower in those calves that came from the ranch and were held for 45 days as compared to the others. So now that gets to this point. We got we make a decision, are we on track, are we not on track? I looked at that in a feedlot processing barn one day, and I just got a nice chuckle out of that. They tried the on and off, but the not on was a better term to use. Now, we have nutritionists in the room, and I'm not a nutritionist. Had some training back in the days when we had Pearson squares and things like that over there in Weber Hall. But are there some things that we can add to the feed that would be beneficial to these high-risk calves? We know that such things as our ionophores, Rumensin, Bovatec, and so forth, they have benefits, and we use those widely and should. But what about some other things? Well, there is a product called Proternative that was studied by our practice and our research division. Proternative is a yeast culture, and I should say at the onset that not all yeast cultures and not all of these things that we can buy in bottles and bags are the same. So we need to have evidence-based information in order to make the decision as to whether or not it would be beneficial for us to use these products in the calves that we're buying and starting, and they're going to turn out on some forage system. Well, here we had calves that were controls. In other words, they had their ration but no Proternative or no yeast culture. And in this column we have the outcomes in those calves that were fed the yeast culture for 45 days. Now, is 45 days the optimum time to feed this? I don't know. Maybe 30 is okay, or maybe 45 is. We don't know that for sure. Your cost is going to be about 9 cents a day per head, but this is what you're going to get in return. These first treatment got 16% versus 12, so about a 25% reduction in morbidity from feeding this product for 45 days. Looking at second and third treats, they have lower treatment rates, although they're not statistically different. The death loss was about 1.7 percentage points lower in the calves receiving the Proternative compared to the controls. And then we look at our average daily gain or the deads out, there's quite a nice difference there, which is also statistically different. So again, another consideration, something to consider when you're trying to reduce the stress on these calves with something other than a needle. Another question which comes up is what about the supplementation or the addition of trace mineral systems, and what type of trace minerals should we use? This one I'm showing here is a meta-analysis, and Dr. Davidson explained what that is, where they take all this information from 19 different studies and put it together, and then they come up with some outcome here to see what the overall effect is. So in looking at those 19 trials where they use either Avila-4 or 4-plex, in the receiving phase, I think it's about, most of the time about 30 days is the length of time that they receive this. The average daily gain was improved by 0.09 of a pound per day. That's statistically significant. The dry matter intake was increased by 0.35 of a pound per day. P-value there is higher if you're into p-values. And morbidity in the calves, so it's excluding the yearlings, but in the calves, they had a 21% reduction in morbidity when fed either the Avila-4 or the 4-plex. So how do we know whether or not we need to use these products? It's not an easy question to answer because we're receiving cattle from many different locations, and now we're feeding hay, at least in the part of the world that I live in, we're feeding hay that's coming from all different places from around the United States because we are totally burned up. Our ponds are low, so the water quality has changed. What does that do to the minerals in the water and what feed they have left on our pasture? Grazing different plants than they normally would, and then buying hay from all over the country. So we can get with a nutritionist, get their advice. If we want to do some diagnostics, liver samples from calves that die of something other than BRD, frozen and sent into the lab, can be used as a really nice specimen, but I would not use it from dead chronics. So if you have a bloat or something that broke its leg or was killed in some other form or fashion, you can freeze those samples for a long time. We can do liver biopsies for determining the status of the trace minerals, certain trace minerals, and we can use blood for others. And also, perhaps we need to check some of our forages, feedstuffs to see where we are on that before we decide what we're going to do with our mineral supplementation. Now, another product that hit the market several years ago, but really has not gained widespread favor, is a product called Zelnate. And Zelnate is an immunostimulant, was developed and marketed by Bayer. Of course, Bayer then sold out, and that's owned by Elanco at this time. But there was a study that was done, I think that Dr. Davidson had mentioned some things about this. The study was done with 2 corporate sponsors. That was Bayer and Boehringer Ingelheim. And to get 2 large companies together to sponsor a study was, I thought, a feat, an accomplishment in itself. But each had an interest in how this study would turn out. None of the employees that worked for the company were directly involved in the study. The data was analyzed by Dr. David Renter here at Kansas State University. About 5,200 calves. So the study was repeated 15 times, an average of 86 calves in each of the pens. So pretty well replicated real feedlot conditions. The calves weighed 624, so that's a little bigger calf than what I would buy, because I don't go to spring grass in the Flint Hills. So I generally buy calves that are going to be sold after I'm finished back running them. I sell directly to the feedlot, or we go to wheat pasture with those in the fall when we have wheat pasture. So as we go through this, we had 2 questions we wanted to answer. One, delaying the modified live virus vaccine for 30 days. And the second objective was to determine whether or not Zelnate would offer some advantages in health and performance in these high-risk cattle. So on the day they were processed, all cattle received a numbered ear tag, pre-sponse SQ, Micotil as the metaphylactic drug, Cydectin and Synanthic for internal parasite control, and they were pregnancy checked. And then we had 4 treatment groups. And to give you the secret code here, DP meant delayed pyramid, so the pyramid was the modified live vaccine that was used, but it was not given for 30 days on feed. AP is a rival pyramid, so the pyramid was given or administered at the time they were initially processed. And then we had the delayed pyramid with Zelnate included in the calves, which was administered at processing, and then the arrival pyramid and the Zelnate. So the Zelnate, in all cases, if it was administered during arrival processing. So we got several points at which we took measurements, but I thought the most appropriate for us would be 60 days on feed rather than going out. But we did follow the calves all the way out to the packing house. So this is pretty busy. So but I want to just make one point from this slide and we'll go to a summary. Notice that the initial pulls, first pulls, are all about the same. They're almost 22 to 23.2%. So the morbidity, first pulls, was pretty much identical across all 4 treatments. Why is that important to mention? It's because that tells us that the modified live virus vaccine did not cause animals to get sick. And we've had talk about the sweat. There's no sweat there that would suggest that this vaccine was stressful because the morbidity was the same in all groups. So to kind of summarize what's important in this, we'll go to the bar graph. Again, it's 60 days on feed. So this is the Zelnate effect. The 2 bars on your left is for overall mortality or death loss. The 2 bars on your right is for the BRD, or the respiratory disease mortality. And on your left, the reduction in mortality due to all causes was about 30%. If you go to the right-hand columns, the reduction in mortality in those calves receiving Zelnate, reduction in BRD mortality in those calves receiving Zelnate was 28%, reduced by 28%. So if we follow that all the way to the end, and if we're in the stocker business and not maintaining ownership, we're not going to own them this long, but that reduction in death loss that resulted from using the Zelnate was about 25% once we got to closeout at 209 days, I think it was. So it does stay with us all the way through. Now the real question then for this product is, what does it cost today? What is your current death loss? So if we can reduce that by 25%, how do the dollars work out? So if you're using this in cattle that have a 1.5 or 2% death loss, it's probably not going to be cost effective. But in all 8 trials that have been done, you're only seeing 1, but in all 8 trials, the death loss was reduced by about 25%. So if you got 5% death loss, then you would expect the calves that receive Zelnate to have a death loss of about 3.75, something like that. 6%, you'd expect about a 4.5% death loss after using this product. So Dr. Davidson also mentioned the bacterial vaccines, and he was talking about pre-sponsored SQ studies that they had sponsored. So this is a slide showing the same thing that he showed you, but what he didn't show you was the economic advantage of using the response in addition to a metaphylactic treatment. In this case, it was Micotil. So if you recall his presentation, both groups received Micotil. The question was, can we afford to use a Mannheimia toxoid like response if we've already invested money in a metaphylactic drug? But in the end, the analysis shows us that it was worth $14.77 to add the Mannheimia toxoid to the metaphylactic treatment in our protocol. So Histophilus, it's a problem. We'd like to see a better vaccine. And so he mentioned also the stacking of products that have endotoxins in them, and this is one of those products which can have higher levels of endotoxin. It's a fascinating disease because this bug can cause brain infections, cause arthritis, pneumonia, and also can cause abscesses in the heart. And here's a heart, and the tip of my knife is right here along this white line. That's the scar tissue. Then on the inside, we have heart muscle, which is beginning to actually rot. And eventually that will form an abscess if the calf lives long enough. The calf dies of left heart failure, so the lungs fill up with fluid and actually drowns. So again, we need a better vaccine to fight that particular bacteria. The veterinarian says, okay, so I castrated the wrong horse. So what's the big deal about $20? So it was just a few things on bulls versus steers. Now, my goal is to at some point in time see all of these male calves leave the farmer ranch without their testicles. And as Dan Thompson has said many times when he was here at K-State and then at Iowa State, the longer the testicles are attached to the bull, the more the bull is attached to his testicles. So the older they are, the bigger they are, the more stressful the surgery. So the time to do this is at branding time. And work shows us over and over again that the weaning weight, after investing in about $1 for a Ralgro implant or a component C implant or something like that, the weaning weights are going to be the same. Take a lot of stress away, to save a lot of calves' lives once they get out to the backgrounding in the feedlot stage if they're castrated when they're younger. So this shows us here that compared to steers, there's a 3.3 times greater chance of these bull calves being pulled once and 2.7 times greater chance of being pulled as a retreat. So the relationship between increases in morbidity and mortality and the sex of these male calves coming in is pretty strong. So we're not going to talk about implants, but I really kind of like this cartoon. The cowboy's talking to the veterinarian. He says, before we treat any more steers with hormone implants, there's a few details I'd like cleared up about residues in the meat. So I was going to give a presentation to the higher level management at a pharmaceutical company several years ago. And of course, they usually go through your slide set and make sure that we don't offend the CEO of the company. And they suggested that I remove that one, which we did. A processing time. So when are we going to process? As Dr. Davison pointed out, there's really not an advantage or disadvantage to waiting, and there we're only talking about the modified live virus vaccine component in our protocol. There's other things that need to be done much more quickly, such as getting rid of the parasites, the metaphylactic treatment, and things like this. So I would just as soon do everything at initial processing so we don't have to take them through a second time. So we process when they're finished walking, they're full of hay, they're rehydrated, and they're rested. They start laying down, they're comfortable. I don't like to process on the day that they get there. The next day or the day after that, probably going to be okay. If they need to be processed any sooner than that, we probably bought ourselves some problems. So generally 24 to 48 hours. So we encourage our clients, we do the same thing with our own calves, to classify these to a risk level, low, medium, and high risk. And it's going to change our processing protocol just a little bit by risk classifying. So the high risk of those calves that are commingled, they're from the auction or they're recently weaned or unweaned cattle that's coming in. And as we move across the scale, the low risk calves are those that are backgrounded, those that have been weaned for 45 days, been together as a group for 45 days, and things like that. And generally, if we've got that much of a history, that kind of gives us a general idea as to what the health challenges are going to be in those calves. Low risk is pretty simple. We are a simplistic group, practice group. We give them a virus vaccine, a modified live, either the 3-way or the 5-way. And I've been leaning toward the 3-way, the IBR-BVD, for many years for the low-risk cattle. the discussion on this is beyond the scope of the meeting, but I'm beginning to change my thinking a little bit about that, maybe going more to the 5-way. We treat for the internal and external parasites, which was discussed by Dr. Davidson. We implant them and we tag the calves. So if they're medium risk, we say, well, I'm not quite comfortable with these calves. They might give us some trouble, but I don't think that there'll be enough trouble that we need to mass treat them. So we add a Mannheimia toxoid like Pre-Spons SQ to these calves. An example, when we were buying calves out of Oklahoma City in July, we looked at these calves, looked at them the next day and said, you know, I'm not too worried about these calves. So we skipped the metaphylactic treatment, use the Mannheimia toxoid, and those so far we have no deads in the calves. Those will be marketed within the next 3 weeks, sold to a feedlot, we hope. So if we want to then move from the medium risk to the high risk, the only thing that's different is we're going to add the metaphylactic antibiotic, and some in our practice are adding Zelnate if mortality exceeds 3%. But within our practice, that's not a universal usage of that product yet. We're also doing another trial on that in one of the feed yards that we work with. It's fairly large, but also has next door their own starting yard where the health challenges are pretty great. Other procedures, we have to manage the bulls. We tip horns only if necessary. Seasonal fly control or lice control. And then, of course, our Clostridial bacterium toxoid. And for our calves, buying lightweight heifers, 450 to 5 weights, too small to palpate, we administer all of those at prostaglandin, Estramate, or Ludolice. We see no negative health effects in doing this. Generally, we get about $1 per hundredweight extra when we sell those as 7 weights, because they say, well, at least you made an effort to rid those heifers of those early pregnancies, and the chances in those 450 to 5 weight calves, heifer calves, carrying a long-bred calf, a late-day calf, is pretty remote, although it does happen from time to time. Now, obviously, even with all of the efforts we put forth in our buying program and in our arrival medication program and so forth, we're still going to have to treat some calves. So why do we treat calves? Well, the classic reason is to reduce our death loss, to reduce our culls. Also, we want to try to get all the performance we can out of these calves, retain our desirable carcass traits, and of course, animal welfare. The animals are working for us. We have an obligation to try to provide them with reasonable care when they become sick. So, diagnosis. So we're not going to ask you to speak up, but just think in your mind, what sign or symptom do you see that causes you to think, I need to pull that calf, take it up to the hospital, and probably treat it? So I can think of one of my favorites is depression, just their mental attitude. But so I put together a list, their physical appearance. Depression, fill, which is proxy for their appetite. Their hair coat, are they licking themselves, keeping their hair coat clean? And what about weakness? Are they laying down a lot? They kind of drag their feet as they walk. If they're to this point, we're probably late with the calf, but certainly their locomotion is something we want to look at when making a decision on whether or not to pull the calf. The character of respiration is also important. And when we look at these first 3, the labored, the noisy, and the rapid breathing, we'll see conditions that cause this more often in the feedlot than what we do in a backgrounding yard or in our stocker calves. But getting down to that last one, the coughing. If we have a calf that's suspect, we watch that calf a little bit, and it'll get up, say, well, maybe it's not going to cause me to pull and take to the hospital. And then it'll take a few steps, and they drop the head, they do this routine. Pretty weak cough, right? But that's a problem. Or you see someone laying down, they'll stretch the head out and they'll cough. They know they need to clear the respiratory tract, but their clearance mechanism does not work very well at all. If we had x-ray vision, you can almost see this exudate going up and just falls right back down. Whereas with us, you hack this up, and depending upon your social situation at the time, you spit it or you swallow it. Now, if we were talking about pigs today, thankfully we're not, but if we're talking about pigs today, when a respiratory outbreak occurs in those finishing barns, they cough so hard that one of the common sequelae is a rectal prolapse. That is commitment to clearing your respiratory tract if you prolapse your rectum. So you're sitting on a horse, that horse needs to cough, they gather themselves up, and you think he's going to explode before he lets this thing go. So that cough is another important sign. Now, to make this simple, Just think of the word DART. So depression, appetite, respiration, and temperature. So DART. We can all remember that then when we're out riding pens or driving pastures. So let's take a look at some calves here. These calves just came in from Kentucky. We backgrounded those for 45 days. The calves did well. Here with the calves already turned out on wheat. We're checking those. Life is good. And here we have a rider checking cattle on triticale in the spring of the year, and looking for the same signs that we just talked about. There's a feedlot shot. Dr. Dan Thompson gave me this slide, and the pen rider is wearing a body cam. And what you're looking for there is looking for that calf that takes his eyes, head, and ears and points them toward you. And it's important, if you're going to really do a good job of finding those early sick calves, that we see the calf before it sees us. We see how he feels without us drawing attention to ourselves. So see the calf before it sees us. Now this is from my training set that I use with feedlot cowboys and veterinary students. And it probably won't show up as well here, but I can tell you that these calves look pretty good. If you can't tell that, just trust me. Now we've got them up looking over the fence, and except for this calf right here, there's a little bit of nasal discharge, but I could justify that and say, well, it's dusty outside, so no problem. So say, those calves look okay, and I'll just kind of keep prodding them along. They say, yeah, okay, we think they all look okay. Then we go back to the pen where we pull these calves, and there's one of them right there, and there's another one right there. These calves came in from central Kansas to a Texas feedlot 2 days before this picture was taken. These temperatures in these calves range from 104.5 to 106, 106.5. But Mike, the cowboy, was one of those who would stop at the gate, study the pen first, he'd scan it, and then he would go in, ride quietly through them, and in every pen he would stop, park his horse, and just to look around like this. Once the calves knew that he was not a threat, and he seldom ever lost a calf in the pen. Going to look at these calves a little closer, and it's a little harder to see here. That calf is up here is sick, and there's another one right beside him that's sick, and then getting closer, this is one of those calves that we brought up, and again, the calves responded well. So scanning before we get in the middle of them is important. Now one of the challenges for me, well here's another example of that. The cowboys had already ridden this pen, and I drove past, it looked pretty good. I thought, why is he standing out there by himself and everybody's up to the bunk? Once the calf thought I was no longer a threat, that's what he looked like. So again, looking at him from a distance is very important. Now, when I go out and check my wheat pasture calves, since we don't feed them very often, then they're a nuisance. It's kind of hard to check those because, especially if you're feeding them on a regular basis, because we don't feed them until they're full. So it's not like feedlot cattle, which they go out and eat and then they're going to lay down. These calves say, well, you gave me so many pounds of distiller's grains every day, so I expect some more today, so they'll come running and they're harder to find. But overall, I get a better view of these calves and I can evaluate them better looking off at a distance and then zeroing in on those calves that shows some signs of depression. Bring those to the chute, and if you bring those to the chute, we're looking for a critical temperature there of 104. We'll reevaluate the eyes, the nose, the stool, and so forth, and if we're satisfied that that's a good pull, and certainly if he has a fever, we treat the calf. If he doesn't have a fever, we look really hard, and many times we don't treat those calves. We call that our respiratory observed treatment, and we'll repull about 15% of those and treat them, but our death loss is generally about 1% in those calves. So if they have some of those in the mix that they pull, that says they're pulling deep enough to get them all, so I think that's a good sign. And so how do we develop our protocols? In our practice, we spend a lot of time analyzing records. So we analyze records to see if we're meeting our expectations. Secondly, we can do some antemortem testing, but we see enough cattle, probably see enough of these, collect enough samples at necropsy time that that's not necessary, and then of course publish field trials. Looking for what we call miracomycin, but so far that has not come to market. So our clinical response, what are we looking for there? We would anticipate that we have 70 to 80% of the calves responding to first treatment. We're going to have a lower response rate in those calves that are retreated because the pneumonia has probably progressed a little bit more, and there's a greater chance that we're going to have more resistant bugs in that population when we treat the second time as compared to the first. We expect a 5 to 10% case fatality rate. If it's over that, we become concerned. If it gets much lower than 5%, we wonder if maybe we're pulling and treating too many animals which weren't sick, they didn't have a fever. Then we also calculate the relationship between the number of culls or railers to the number of deads that we have. Here's an example of a report that we would put together, and we do this every week. Every Sunday I get a report on dozens of feed yards on how the cattle responded in the previous 60 days. And so we're getting more and more good health management computerized systems in the stocker business, so I think with time we'll be able to do more analyses on the stocker side. But in this one, we're using Zactran as a first treatment. 300 were treated, 78% responded with a 3.3% case fatality rate. This is a very disciplined feed yard. The manager drives every alley every day, and if a pen rider misses one, you go back and get it. So we have a very low death loss in this feed yard, and they feed primarily auction market cattle. The Bacterial, we treated 67 head, 79% responded, 6% case fatality rate. And for the new floor, our final treatment, only treated 14, so it's really hard to make any sense out of that. So in this case, we had a better response in our follow-up treatments than what we normally see. So we look at another feed yard over a 60-day period. We treated 1,000 head with Draxxin, 82% responded, 7.6% case fatality rate. So we're still meeting our expectations. Retreated 38 of those with new floor, not a very good response because a lot of those had to be retreated. 15%, almost 16% of those died. Again, only 10 were treated with biomycin, so having a high case fatality rates, it's really hard to determine whether or not there's an issue there because the numbers are so low. And a final example that we have are low-risk calves. So we would have a low-risk treatment protocol and a high-risk treatment protocol. We treated 248 head with biomycin 200 as a lead-off treatment, 85% response with a 2% case fatality rate. Now that's lower than what we expect, but these are low-risk calves. And many times these cattle have been on feed for more than 30 days, so they're going to respond quite well compared to some newly arrived calves, which are bringing some stress with them. Bacterial, 73% response following that, 14.6% case fatality rate in those calves treated with Bacterial, and that's pretty much in line with expectations as we go from one yard to the next on a weekly basis and look at those reports. Again, not enough went to new floor to make any sense out of the outcome there. So antemortem exam, we can take samples there, send them off to the lab, get some guidance on antibiotic selection. We also look at field trials in the published literature. Dr. Davison shows you several field trials today covering various topics. It gives us evidence-based decisions that we can make by going back and looking at these controlled trials. In this trial, there's no difference in drug A and drug B, so we just say, okay, what's the ease of administration? What's the cost? What's the withdrawal time? And maybe you might like one salesperson better than the other one. So no difference in the two. Looking at this trial, looking at drug A versus drug B, there is a lower death loss percentage in the cattle that receive drug Bs compared to A, so we might further investigate that and see if we want to make that selection over the drug that's in A. And finally, necropsies are important. The client is saying, listen, doc, I ain't one of your small animal clients. What do you mean? His little heart couldn't take it, so we necropsy. This is Fidel Nieto, necropsying with me. Excellent diagnostician after working in a feedlot for several years. He's now moved up the ranks and he's a head feed caller for a almost 100,000 head feed yard. We don't see this very often in stocker and feeder calves that die, but these are normal lungs. Pink, soft, spongy, everything is good in that part of the animal. But if we look at the next one, we see that only about 10% of the lung is remaining, between 5 and 10%. All of this, if you follow the red dot, all of this is mnemonic, and we got the yellow jelly stuff on the outside. And the chances of this calf surviving, even if it was treated on time, would be very low because there's not any lung left to work with. I like to ask the question, did we miss something here? Well, our cowboys and cowgirls didn't miss anything. This calf arrived into a Kansas feed yard the day before the picture was taken. He died on the way to processing. So we also classify the deaths that occur early in the feeding period as off truck. So this then gives us This is a reflection of the procurement practices, and it takes the heat off of the cowboys and cowgirls because they can't change the outcome in those off-truck cases. And a more chronic case there, a hematogenous pneumonia where bacteria is picked up in the bloodstream from a liver abscess or from, let's say, a foot rot or a limb injury. That bacteria gets in the bloodstream and it's filtered then into the lungs, and you'll have hundreds of small abscesses there in the lung field. Can't see that one well, but vegetative lesion in the heart. And here we have one that would have been called a respiratory case if we just gave it some antibiotics and it died and didn't look. But the lung is compressed clear up here at the top. This is the lung right here. This is the heart sac. We made a little incision in it and urine-colored fluid comes out. So this calf died of pericarditis, infection around the heart. And we see lots of heart lesion in cattle as compared to some of the other species. But again, this was not an override respiratory case. And then finally, we have, in this case, which could have been called a respiratory case if we had not necropsied it. But once we open the calf up, we see peritonitis secondary to an abomasal ulcer. But what's really important, and you'll have difficulty seeing this with the lighting, there's white spots in the liver. We culture those, and we culture salmonella. Salmonella, which is also contagious to people. So it's important for us to know from a public health side as well as what's causing the death in our calves, because our mitigation strategies are going to be much different in animals that are dying of salmonella versus those that are dying of respiratory disease. One other example, in one client's operation, they had 20 calves die in 1 month of cellulitis. Cellulitis is kind of the same as an abscess, except it's not walled off. It spreads under the skin. Had we not been necropsying, those would have all been called respiratory cases. But the problem there was a contamination of their drug delivery systems at processing. And so when they processed calves, they were pumping contaminated product into these calves subcutaneously. The infection developed and spread under the skin. And so once we make the diagnosis, we go to the processing barn and we throw everything away that had been opened. Syringes, any bottles that were open, and we started fresh. And when we did remedial training on cleaning up our equipment at the end of each workday so that we don't run that risk again. So there is a lot of value to necropsy and getting a diagnosis and so forth. Well, we're, and the big abscess. And a happy young veterinarian. She wanted to spend a week with me. And a marvelous veterinarian. What I liked about it is that she'd been in school been out of school for 3 years. We had about 20 calvers that week. And she had shoulders that were narrow enough, arms that were slim enough that she delivered them all. And I didn't have to do any of them. And I thought that was really great. So evaluating our treatment response, temperature drop, weight gain, and their clinical appearance. Well, I think we're running just a little bit behind, so I'm going to quit there. And I, again, am honored to have been invited to come today. And I've enjoyed meeting those that I've met thus far. And Dale, wherever you are,